So basically, we started the day, as you rightly mentioned yesterday.
Yeah, right.
But of course, there's been a journey for many years. And basically, for this week, we are showcasing and really telling the public the thinking that has gone into what we call universal health coverage.
Yeah.
And we are premising on 4 pillars. The first pillar, of course, is human resources for health. And you know that the health sector is quite human capital intensive. We need the human resources for services to be provided. We are also premising it on the second pillar, which is commodity security. I think you know rightly that most of the biggest problem when you go to a hospital, like that's why most of our hospitals and health centers, people tend to shy away from, is the moment they get there and there are no commodities. So part of that second pillar is how do we make sure these commodities are available, they are affordable, and in the right mix. The third pillar, which now that speaks to the conversation of today, is digitization. Yeah. And we know that the world has really grown in terms of information technology. Likewise, the health sector is also growing. And we think that digital health provides an opportunity to provide efficiencies. It provides connectedness, people talking to each other, applications. We are even able to get the patient journey from the household all the way to the facility, and we can still send the same patient back to the facility. So that is the fourth pillar. I'll be speaking to it more. And then lastly, of course, we need the money to run this sector, and that is when the healthcare financing pillar comes in. But in all this, the foundation is the primary healthcare. And we saw that yesterday, that when His Excellency, the Deputy President, landed, the first assignment that he did was to go to a household. Yeah. And in that household, we were showcasing our community health promoter is able to engage with the household, do an assessment of a patient or a client. We actually don't like calling them patients. At the community level, they are clients. Some of them are not sick. They are just following up is health promotion. And using an application on a phone is able to capture those records. And that record is transmitted to the next facility, which we call the SPOC or the link facility. And the deputy president actually moved from that household. Then he came to Cheborke Health Center. And in that health center, which is a level 3 facility, we were able to showcase that record is actually available. All what the facility can do is to start serving that client.
Right.
And we ground it all at the hub. So as a directorate, we are changing the way we digitize. For many years, digitization have always looked at facilities. Mostly if you look at our facility, majorly it is the level 4, which is sub-county, and the level 5 and level 6 that are digitized. And what you are simply saying is, can you digitize this primary care network? We are talking about facilities talking to each other. So if you come from a community, you have an application running on a phone.
Right.
The next thing, you arrive at dispensary. It is paper. So what are you telling our community health promoter? That you need to again refer that client and you need to fill a form. I mean, that is going backwards. So what we are saying is, let's digitize a primary care network. You come to a dispensary, it is smart. It's already having a digital application, an EMR. You go to a health center, it's having an EMR. You go to a hub, it's having an EMR.
Right.
All that records are moving, feasibility is there, and you don't need to struggle. You don't need a patient to remember when was the last time he was given an injection.
Digital connectivity is at the heart of this. And today we are talking digitization. We are certainly expecting to hear from the CS of ICT in relation to what they have achieved as to the progress of making sure that we have digitization across the country. Just how far are we at? Because then one would want to understand. It is good to speak digitization. It is good to say that, well, we want to do away with the paper. But say in a county like where we are,
Kericho County, yes.
Just how far are we?
Yeah, amazingly, if you look at the digitization of the fiber optic, there's the national fiber optic. We call it a NOPI. They've actually been pulled all the way to a sub-county headquarters. So when we came to Kapkatet, the fiber optic was 70 meters away from the hospital, and yet that connection had not been done. And we have actually worked with the Ministry of Information Communication, Digital Economy, to actually pull that fiber optic all the way to 11 facilities. It's a bit expensive, but we have managed to have those facilities connected. So we know that most of our hospitals are not far away from a sub-county headquarters. We also know that there is the initiative to digitize schools, and most schools are co-located with dispensaries and health centers.
Yeah.
So basically the conversation is, can we work together? We map out the routes of those fiber optics. Sometime, I think I was being given an example in Julaimbo. The fiber optic was just outside the gate. All what you needed is just a short distance, not even 500 meters.
Right.
And you have actually gotten the fiber optic into the facility. When we use a fiber optic, is a bit cheap compared to using cellular network. But we also know that the penetration for cellular network is also good. So sometimes you can also have that mix of fiber optic and cellular network, but the preference is to use fiber optic.
Do you suppose there's more that needs to be done, or we are on course in terms of now the ICT sector coming in to boost this?
We are on course, but definitely there's quite more that needs to be done. We are talking about 15,000 dispensaries and health centers across this country, both private and public. Definitely some are quite far away from a fiber optic, especially in the ASAL counties. So there's in some places is Isha is within the vicinity. Others will really need to do more. But I'm sure when the CS comes in, you'll be able to speak to that, because I know there are quite a lot of initiatives speaking to the last mile connectivity on the digitalization.
And in this case, you mean the CS for ICT?
Yes, the CS for ICT.
Honorable Eliud Awalo.
Eliud Awalo, yes.
All right. When we talk about these progressive plans and strides that we have made, and we're holding this progressive conference, as we speak to the people of Kenya, that message of hope is crucial. Perhaps it can't be painted better if we do not look at where we come from. So could you please paint a picture of where we come from, up to date, and where we intend to proceed, and especially when we're talking about digitization of the health sector?
Thank you. And the journey for digitization, amazingly, it goes back several years, maybe late 70s. And for us in the health sector, we want to look at it in 3 phases. So initially, the need was reporting. So you sit in a hospital and you want to know the workload, the number of cases that we see, workload and the diseases. So what we then struggle was how do we send this data back to the central place? And we could use Excel, we could use file transfers.
Yeah.
Then, of course, we came with what we call the District Health Information System. At the moment, we call it Kenya Health Information System. So that focus was on reporting, which we know that we need the data for decision making, for planning. But then, with the advancement of technology, we realized that the technology can also be used in managing the patients, managing their records, so individualizing or getting an individual patient record. And that is the era of EMRs, electronic medical records or electronic health records. And in Kenya, we took a bit of time to adopt, but we know that there have been a lot of move. A number of hospitals have actually put in place those EMRs. But the moment you have EMRs in facility X and another facility Y, when a patient moves, the records doesn't move. Yeah, because you are siloed. You sit on your own and in your facility, and yet the patient, we know that they move. They have to move from, they seek services where there is need. So then, of course, you print out a record. Yeah? So then the era where we are at the moment is saying, can we interoperate? Are we able to facilitate all these EMRs to talk to each other? And that is the moment, the vision now for the ministry is to say we want to talk about interoperability.
All right.
And for us to interoperate, it means that technology, we need to speak the same language. We must have systems that facilitate that talking to each other. Let me use the simple term, talking to each other.
Okay.
So that if, interestingly, malaria tests can In many places, the way they are quoted is totally different. So we want that when you say you have done a malaria test, then it is quoted the same. Whether you are in a facility X, in a private, also in the public. So that means we have the same, and actually we have done some work in terms of deploying what you call National Health Data Dictionary. So it defines the services, the diseases, the laboratory procedures. We are also trying to push the boundaries also to make sure that the commodities are also identified nationally.
Okay.
So the current area is interoperability. And we actually, in the last 2 months, we were able to bring together stakeholders, both private and public and NGO. We converge into a 5-day meeting, and we all agree that as a country, we are now moving in one direction, guided by what you call the Kenya Digital Health Superhighway. And that superhighway is basically, one is that we are recognizing individual facilities who still have to invest on their EMRs. But as a government, we focus on the core service, which is basically providing an exchange platform. We also want to standardize and have a common platform for claims management in insurance, the commodity flow, which you call logistic management information system, and a telemedicine. And as you all use these common services, you facilitate reporting, and you also facilitate even regulatory bodies to access information that is relevant to do their job. So that the future for this country is now the Kenya Digital Superhighway, and we expect our Cabinet Secretary, Nakuminja S. Wafula, she'll also be speaking to that vision in today's session.
All right, and certainly we are looking forward to that. One of the key things that we expect for this session is largely on the conversation of just how we have developed in terms of data protection and all this conversation. Yes, we ask ourselves how we got ourselves to the conversation on data, but also the story of protection. And concerns have been raised on several occasions that in as much as we appreciate the fact that we're moving digital, lots of concerns are raised as to just how safe, and if the individual's data is, and especially when it comes to the question of health, there are conditions that are quite private to a person. How then do we guarantee this? Or how do we strike a balance in relation to making sure that, the people are able to enjoy the services, but at the same time, they do not have concerns as to, the risk of what their data is all about?
Yeah, and really the foundation of digital superhighway is data protection and cybersecurity. And we can look at it in also probably 3 levels. One is the legislation and the laws that are in place to make sure that whoever is generating the data, especially on sensitive personal data, must follow certain conditions. So we do have the Data Protection Act of 2019. And recently we have also taken through Parliament the Kenya Digital Health Bill, which has been passed, and hopefully it will be ascended into law in the next few days. So that provides sort of the legal basis to really enforce data protection. We also develop certain governance documents. We actually will be launching soon what you call the Kenya Data Governance Framework, which says who can access what and at what level. So that is on the side of policies and regulations. But there's also technology, the firewalls that are put in place, the protection that we give to even accessing our data centers. But I think the key point at the end of the day, and the breaches is likely to come, is at the user level. And remember, when you go to a hospital, there's somebody who has been given credentials to access and manage your records. And that requires a lot of training, because a lot of responsibility we are giving to that person. And actually we are encouraging counties to appoint data protection officers, and they regularly train our healthcare professionals on how to manage their passwords, how to change their passwords, and regularly. And we also, of course, making sure that the servers that we have, we own them, and they are within the boundaries of this country.
You speak about encouraging the counties, and I think if we're going to attain that aspect of afya, manyumbani and mashinani, then the counties will certainly play a huge role. Also, we understand that health is a devolved unit. So just what are the active activities playing out across the Ministry of Health and the various counties in making sure that then there's a strike of balance across the different counties. And I know that even as we progress, there are certain counties that are given preference in terms of, them acting as case studies. I see one of the things that we are focused on. I know Kitengela is not a county, but as well, there's been that conversation as to the benefits of digitization, using Kitengela Sub-County Hospital as a case study. So what are the activities that are being worked on in synchrony between the national government and the county governments as to attaining this?
Yeah, so we do work with the counties. Actually, we do have an interagency coordinating committee. I co-chair with the CC for Kisumu, Dr. Kanta.
Yeah.
So whenever that forum it guides in formulation of policies and guidelines. So we work together. We also provide technical assistance and support to the counties. You mentioned Kitengela. They are running an application called Afya KE. It was developed by the ministry and tested in Kitengela. Already Muranga is also deploying that. And when they are deploying, we come in with our experts, but we also work together with the experts in the counties, both from the Ministry of Health and also Ministry of Information, Communication and Digital Economy, so that we build their capacity to be able to manage those applications. So the national government, our responsibility is to make sure that we give technical assistance, and we actually work together in doing assessments. We do the trainings, and we also provide, let me not call it oversight, but we do support on a regular basis through supervision and continuous engagement. So national government, I don't know how many hospitals do we have, is only level 6. So everything happens in the county, and we must empower the counties. And they are quite committed, actually. I mean, we just saw in Kapkatet, the application that they are running, they were the one managing it. And as we set up that application, we identify the super users, the people who are willing to be capacity build and develop so that they manage the system. But the digital health bill also is creating an agency, and what you call a digital health agency. And we believe with that agency coming into being, then it allows us also ability to attract expertise that is required to manage such a complex ecosystem. And that digital agency responsibility includes also supporting the counties.
Very important that we discuss the expertise. Very important that we also get to understand how the medics or the people who are in line with the health sector, how they are aligned to these transformations that are coming on board. And so allow us to take a quick short break, Sini, and then we're going to come back and get to understand some more as to what the country is doing to make sure that, well, even the medics, different cadres, then they are aligned as to the adjustments that are being made, because, well, most of them will tell you that they did their trainings way then when perhaps we had not advanced to this level. So is it a constant process of training, or what exactly that will get us to have the right expertise? So we take a quick short break,
No worries,
and
sir.
we're back on Morning Cafe. right, welcome back to Morning Cafe. It's a special edition of this broadcast as we are seated somewhere in Kericho County and coming to you live and direct from Kapkatet Stadium right here in Kericho County. The conversation about universal health coverage and how best as a country, as the government, they are ensuring that they push for universal health coverage for every Kenyan at the level of the household. And as we're having this conversation, we are having a conference that runs for approximately 1 week, beginning yesterday, going all the way to Thursday. And the last conversation about this will be on the 20th of Mashujaa Day, this very month, that is on Friday. And the conference is Mashujaa Conference on Universal Health Coverage that is being held right here in Kericho County, just looking at the progress that we've made in the health sector and equally focusing on 4 pillars that would drive us, in the next few years towards attaining this in totality. And we're having a conversation right here as to day 2 of this, conference that focuses much on the aspect of digitization. Dr. Bernard Langat, the acting head director of Digital Health Policy and Research in the Ministry of Health in Kenya, is with us this morning as we unpack what we have made in form of strides and where we are headed and what plans then they have. Remember, we'll be having the ICT CS, that is Honorable Eliud Owalo, gracing the occasion this morning, and therefore we are eagerly waiting to see what they have in store for us in terms of making sure that they complement the efforts of the Ministry of Health. Thank you so much once again, Senior, for creating time to be with us. And so we are at this space where we then want to understand, how do we ensure that we get the right workforce, the manpower, one that is digitized, understands technology. And we all acknowledge that we have doctors that have been trained during the times when technology wasn't as advanced as it is today. So how do we shape this to ensure that, the entire workforce then understands this so that it also culminates or it goes down then to the people?
Yeah, an interesting question. And basically, we have created a unit managing deployment and change management. For sure, change management will be the biggest worries for us. Anytime we go into a new facility that is naive.
Could you tell us some more on what?
So we are used to writing notes. Yeah, you can imagine as a doctor, you are doing a ward round. You are used to writing notes. Yeah. The nurses do the nurse cartex. So we are used to writing on paper. Now we asking you to type it or use a keyboard. So that is not easy. Yeah, that shift is not very easy. And but we also know, and we can start with the basic community health promoters. The worry was, are they able to use a smartphone? And we have seen them taking that technology quite fast and no challenges. So the application also are quite intuitive, so they are easy to navigate through. But the first thing you need to do when you get into hospital is you start from a premise that the solution is to bring efficiency and you make your work easy. The healthcare worker must see what is in it for them. We don't want to come and say we are policing you. We now know how much you are doing in a hospital. Really, the idea is a solution that makes your life easy. And they are very good early adapters. I think you saw that you are going to have Kitengela and Sipwe. These are the people who have actually embraced it. And when we hear the story from these very grassroots service providers, we hope that is also going to motivate the rest of our staff to pick it up. But yeah, we are used to our phone. There's nothing much different from a computer and a laptop with what you use with your phone. So is a lot of training, is a lot of constant engagement. The leadership has to come also very strong. In fact, our entry level is we start with the governor, and so that he sees the benefit of digitization. And wherever he is or wherever she is, then he speaks that language. You come to the CEC. So the first entry meeting normally we do with the leadership. Then we come all the way to the facility. Then we also go to the level of the healthcare workers. We choose all-site training, not individual training, because we want each and every service provider or healthcare worker in our desk understand how to navigate the technology. So it's not a one-touch thing, it's constant engagement. We identify super users, those who are quick in learning, and then they become the champions for the application. And we also capacity build them so that they are able to answer simple questions that may emerge. We also set up customer care desk, because you can imagine a situation you are seeing a patient and you are stuck. Of course, it's quite embarrassing. You have a patient, and so we also must make sure that somebody is on hand to actually support you. So it's not easy. Change management has never been easy, but I think we have seen it happening at the community level. We have seen it happening in the Kitengelas of this world. And when people see the benefit, and especially on making your work a bit easy, improving the care of a patient, healthcare workers wanachali. Yeah, I mean, every time a patient comes and leaves a hospital, well, they celebrate, and they are very happy to be part of that journey. So we haven't, it takes time, but we haven't seen any pushback. Yeah, but we have to also look at the technology that is easy to use. Yeah, so that we facilitate.
We have reports that in different counties, and I think having seen this being pushed during the Jubilee government, we witnessed lots of facilities benefiting with great equipments, technological equipment, some of them that have not been put to use. Do you suppose that lack of understanding and knowledge could be one of the key problems that informs this? And what is being done to make sure that, well, if a facility then is well endowed or they get the right equipments, then these equipments are put to use?
Yeah, so and that's what we say, we do an assessment and we do an engagement. It's actually it is not the national government coming and saying you require this. It's a conversation that we engage. And by the time we are leaving, we know you require this equipment, these end user devices. I mean, go to the ward round. You are not going to carry a laptop. You need a tablet. Yeah, so we sit down and even for the application, an application running in the lab is totally quite. Some of the lab equipment are quite smart. They are able to communicate with the systems. So we are not seeing It's not a decision that is top down.
Yeah.
You own it. We sit down and plan together with you. So whatever equipment you require is what we put it in terms of deploying. And of course there are challenges, especially, but that is more of technical equipment. I think the question you're asking is around if you have got dialysis machines. Yeah, but this is more of a assistive device, really.
Okay.
Yeah, it's a facilitator for you. But to run a computer, and we all learned the computers.
Okay.
We didn't go to a classroom for a computer.
So is this also being done at the level of trainings, maybe at the medical school? So likely then there's that training in relation to just how to handle a computer before then they proceed to the next level.
Yeah, I think most colleges are doing
yes.
that. But we are also, one other aspect also, we have got also kind of staff that are basically have been managing records.
Yeah.
There are L records and information officers or managers. And so we have had conversation with universities and colleges because we need to retool them. You are used to filling the forms and transmitting the data, but we want to convert them into, and we have seen even within our directorate that some of them has actually acquired new skills. So they become software developers.
Yeah.
Yeah, there are others have become, they manage the system. Others are, they become analysts or analytics experts. So we are also working towards making sure that they are retooled so that when they are coming in, they need to meet the needs that is matching. So we have started those conversations with the universities and the colleges to look at the curriculum that are coming, but even after coming into those who are already in the field, which trainings do we require? Yeah, because if you can imagine the data that, for example, let's start with analytics.
Yeah.
The data that is, you have a line list of, we are used to reporting numbers, the count data. But right now we have got a very rich data where you have got all the variables, from the age to the gender, even socioeconomic status, all the way to the condition. I mean, that is a huge data that if we require experts to analyze and make sense of it and give us insight on how the health sector is. In fact, the future probably, do we need to do surveys? Probably in the future, because we have got almost a comprehensive inventory of the different services that we provide. We may not require to do surveys. We also then have to bring in new things like artificial intelligence and machine learning, so
Right.
that we are able to build predictive models. Or basically, is for us is an amazing. I mean, for electronic community information system, hopefully we are going to get all the 50 million Kenyans registered in that platform. That is huge.
That is good.
You know it. The efforts we take to do census.
Yes.
So you can imagine every day, every month, every year, there's someone collecting, because we expect our CHB to go to a household
Yeah.
every quarter.
Right.
And whenever they engage with you,
Right.
they collect information that we think is very relevant, not just to the health sector, but other players and other sectors.
And I know you've mentioned the aspect and the pillar of financing on this, yeah?
Yes.
While it is quite progressive, we also have to acknowledge that the cost implications are, things that we cannot wish away. And perhaps they could weigh down on the capabilities of the health sector, much as it's one of the sectors that gets the largest chunk when it comes to budgetary allocations. How are you managing this as a ministry to make sure that it trickles down to the counties and trickles down to the various hospitals across the country successfully?
Yeah, so it's not cheap. I mean, for Capcatet and the networks, probably we are outside the connectivity, we have spent almost 29 million with end user devices and the training.
Oh.
So that, and we are talking about 11 facilities plus the hospital. So it's not cheap, but we are looking at their partners also who are, we are having conversation with, and we are looking for options. At the moment, we know that, for example, the HIV program, they currently have EMRs running is close to 2,000 HIV comprehensive care facilities. And we are simply telling them it is easier for you to expand to the facility. So we are looking at the many options that are available. The partners that are currently having an element of digitization in the hospital, you expand, it becomes a bit cheap. But we also looking at other financing options. We think that when you run a very efficient system, you can actually levy a fee that can easily generate revenue to sustain the system. So the option then is, can we explore somebody to provide the capex, the capital, and then they are able to recover over a period of an agreed period of time. So those are conversations that will come, and but we are committed. I think the government is committed that digitization is not. Is the direction to go. So everyone must be on board.
Yeah.
And with there are investors who are willing to put money there, and they have given value proposition on how revenue can also be generated to sustain it. So it's not, and I think you have seen the leadership from the top, from the president. It speaks digitization. And we think that. Yes, it requires a huge capital investment, but if you look at the benefits, it's huge.
It's a plus.
The efficiencies that comes in it, commodities, the fraud that we know that there are challenges about fraud, especially in insurance sector.
And
those can be
invested.
Like Itagela, for example, they're able to show us that they've been spending almost 400,000 on paper files and whatnot.
Yeah.
And the moment you go paperless, that goes out. That is a huge savings that can be reinvested back into the application.
The very same sector.
Yeah, so we are looking for those financing options, but we are very confident that is a direction that the ministry and the government has met, and there's no going back. We just have to get everyone paperless and connected.
And this we might not want to focus much on, but is a factor that we can't ignore. And especially when you troubleshoot the problems and the concerns that would come with the adaptation of the ICT. For instance, health effects. And some people will tell you that there's going to be high strain, back pain, repetitive strain injuries and all that. So how do we manage this? That, eventually, again, it does not become Pandora's box or more of trouble than actually a solution.
It's interesting.
Yeah, it is interesting, but it's actually factual, and across
Yeah.
different countries that have adapted this, they will tell you that they have had these concerns, and therefore it's important to have the conversation so that we counter it before then it becomes a big problem.
Yeah, I mean, when you use a lab, I mean, just sitting, your sitting position, the right chairs, even the clear making sure that the screens they are not very irritating. So those are consideration when you are selecting the devices. So we do put that into consideration.
Okay.
Yeah, and definitely we must make sure that the workplace is conducive, especially for the people seated behind those computers. Yeah, so it's a consideration as in terms of implementing.
Okay.
Yes.
All right. So we have touched on telehealth, telemedicine. Of course, generally focused on the state-of-the-art reporting and dashboard tools that are needed. That is on the aspect of communication. Just how huge do you suppose we're going to get into that space where patients then will self-diagnose or even monitor their illnesses, with the help of digitization?
Yeah, so the digital superhighway is also envisioning a situation that actually the wearables, those maybe the one you put it in your wrist, whether we can actually provide a connection to the superhighway. So there's those wearables and point of care devices can actually be connected into the digital superhighway. At the moment, I don't think we really have integrated or connected, but that is the future we want to live.
So what exactly do we mean when we are talking about afya nyumbani, afya mashinani, and we're looking at these 4 pillars and components that are ensuring that we drive this?
So afya nyumbani is grassroots. Yeah? So it is service provision, health promotion at the comfort of your neighborhood or your household. That basically is the language, and the household means the community health promoter. But also when we say locality, it goes your dispensary.
Yeah.
We want you to start from the household and feel comfortable to go to a dispensary and be able to be given our services, not moving all the way from just with OMA. Unakimbia level 6, KNH, or Moi Teaching and Referral Hospital. We want to make sure that the primary care services is sufficiently provided at the community level, at the dispensary and the health center. And basically most of the common conditions that we have, 80% of them or even more should be managed at that level. So that the only cases that then come to a hospital is the very few that the staff who are there either don't have the capacity to handle. Then it becomes a referral. So we want to push back, change that narrative from that focus on curative services, patients and clients always coming to a level 4 hospital or a hospital. And you can understand them. When they make a decision to go to a facility, they want to make sure that it's a facility that when I go, I'm able to get all the range of services. So if I don't believe my dispensary or health center can do that, then there's no need for me coming to that facility. Unaambia hakuna dawa ama hakuna laboratory, then you move straight to that. So we are saying let's invest at the grassroots, the community level, which is level 1. Our dispensaries and health centers, and those must have the capacity to provide the services. So we need to invest money in them. If it is a laboratory, let's equip it. If it is drugs, let's equip it. If it is a human resource, let's have the right human resources for that facility. But then also recognize that there is need to refer, and we facilitate that referral. So that really is the shift, is more preventive and promotive. That happens at the community and the dispensaries and health centers.
Okay.
And if we do that, then we reduce the need. And we think is actually for every, there are a lot of savings. I mean, if you look at it, actually if you invest $1 in a health promotion, you probably gain $9 vis-a-vis if you are going to get to a curative level. And by the time a patient is coming, the condition is advanced.
Yes.
You require more, and probably the outcomes are not very good. You get it early, you intervene, and you save both in terms of the outcomes and the quality of you save, but yeah, and also reduce the cost that the system carries. We spend almost 500 billion Kenya shillings in health.
And making sure that this...
Yeah. And we think that is a lot of money that if we focus on preventive or promotive services, then we even get better outcomes.
That's true.
Yeah. So invest in grassroots, the dispensaries, the health centers, that is the primary care level. And we think that we do that, we have saved this country a lot. And whatever service we get there, we reinvest in probably providing more advanced care for those we know eventually every continuum of any time you see there's a progression of a disease, definitely at the end of the day, that may require advanced care.
Okay, and this must have begun at the global stage, perhaps still at the global stage. And I look at some of the studies that have been conducted in making sure that digitization that is embraced at the level of the health sector. The developing world or the developing countries still, making the baby steps, but with lots of difficulties. Just how are we working with developing partners as well as the global stage to make sure that this then is well aligned? Because we have seen ourselves sending, patients from Kenya to other countries, to India, for better checkup, for better healthcare services, and perhaps we want to just bring this home. But even before it gets there, what is the synchrony between us and the entire global community?
Amazingly, if you look at interoperability conversation, which that is the next level we are taking it, actually the developing are struggling. Maybe it's a PTC for countries like Kenya that we are adopting the technology quite late, and we have not invested a lot on archaic technology. So the performance across countries it varies. There are those that they are doing very well. I think India at the moment they are now covering almost 300 million population with a comprehensive system. Countries like Korea, I think fairly they've been in it for a long time. So everyone is playing in a different level depending on the regulation or even the business models. Especially if you are heavily private sector driven, so the motivation to share information also becomes and interoperate becomes a bit of a challenge.
Right.
So I mean, technology-wise, we are coming a bit late, but I think we'll probably be at the same par with most of the players globally.
Do you suppose the rest of the global community is willing to create a balance? Because there's been quite an imbalance for a long time. So we just want like that level ground distribution and balanced distribution of the ICT benefits so that, there's immense appreciation and benefits for everybody across the stage.
Yeah, WHO and other partners are actually supporting, interoperability, use of common standards, because that is the basis really. Of course, we also really want open source technologies because a number of proprietary solutions is quite expensive. So there's still a lot of advocacy work to do. But we encourage the technology partners also to align with the vision of our country. This is the direction we are going. We have had some engagement. There are bits that they can actually assist as part of CSR or more even a subsidized cost. Yeah, so there's that need for more open systems, more using standards. I think there is more we gain by working together than being the only one with the best technology. So yeah, there are those efforts that are going on, and hopefully we'll be there. A connected world is better for all of us.
Okay. Yeah. And you're going to tell me that we have the Minister of ICT today, we had the Deputy President yesterday, we have the Minister of Health, we have had, the governors and the politicians. But I mean, perhaps the viewer would want to understand if there's some element of political goodwill, especially, to implement all this that is on paper in policy. Because it's one thing to join the congregation and as well get to the conference and speak, but then it ends up being a lip service. Do you acknowledge that we've witnessed some bits of this goodwill?
I think the goodwill is there.
Yeah.
I mean, one of the biggest ambassador and promoter for digital is the president. His Excellency, the president really and I think for the health sector, we are recognizing and appreciating if every week, and even there's no week that goes by without our president mentioning community health promoters. It doesn't mention digitization. So I think we have got the goodwill. We have the goodwill, and as the health sector, we are actually motivated, and we are even pushing ourselves to take advantage of that goodwill. A goodwill is a resource that it can be taken away very quickly. So we have seen in the last few months 4 bills that have gone through Parliament. That is an amazing legislation in the health sector. We haven't had that in a long time. 4 bills going through the Parliament, and already 2 are ready for assenting. We have seen this thinking and the focus on the UHC. Really, I think the health sector is actually embraced and is running with the president. And there's commitment, and I'm sure the CS will speak today. And actually, she mentioned yesterday. Yeah. Is a challenge. She actually mentioned if there's any other time she has enjoyed a walk, is what she's doing now. Right. You can look at that level of the and we have gone all the way to the community health promoter. The excitement that is there, that they have been kitted, they have been given a phone and they are being given stipend. I think the health sector is in the right time to make a difference, and we need to run in the next. That we really have to get it running in the next few months, and I don't think we want to give ourselves even more than 2 years. Yeah, and I think that commitment is there, and we will see it even in this conversation. I encourage the viewers track what is going on here. Is the testimonies you are bringing is not testimonies from a boardroom. You are bringing testimonies for people who have worked that journey. Yeah, it's not a make-believe. When Akitengela speaks here,
yes,
he's not a CC, he's the person who sits in that facility.
Yeah.
When Shipe comes in here, it's the people who have worked that journey. Okay. When a CHB promoter is speaking, it's the people who have worked the journey, and they have been there. Mm-hmm. That is the greatest advocate also. Right. So we are actually taking a backseat as a ministry and allowing them to, because we are here to facilitate them and make their job better and improve the service delivery.
All right. Well, we are speaking to Dr. Bernard Langat, the Acting Head Directorate of Digital Health Policy and Research, the Ministry of Health. We'll take a quick short break, and then we come back in about 5 minutes. We wrap it up by understanding what is the vision and what to expect today and tomorrow and the day after tomorrow, before we close this Mashuja Conference of Universal Healthcare, or on universal health coverage in the country, Kericho County. We'll take a short break and we're back. quickest and last laps of this segment that we have had on Morning Cafe. Remember, the conversation is on the Mashuja Conference on Universal Health coverage being held right here at Kapkat Stadium in Kericho County. And we pitch tent here to make sure that we make you understand as well, enlighten you as to the plans of the government in how best we can achieve universal health coverage across the country, and that is at the level of our homes. So speaking to us this morning, and I think I'll give him about 5 minutes to run us through what we expect for the better part of today, even as we focus on digitization of universal health coverage, is none other than the acting head of Directorate of Digital Health Policy and Research in the Ministry of Health. That is Dr. Bernard Langat. So, Daktari, we have about 5 minutes to close it before we cross over to the other side where my colleague Muige is on standby to update us some more. What do we expect for the day, and what do we expect moving forward, the vision?
Yes, so thank you, Linda. And so basically, we have got a program that is running both the morning part all the way to noon, and then in the afternoon. So basically, in afternoon, the way it has been designed, there are exhibitions. So you are able to walk through the booths. You are able to see in those booths what people have been doing. And I say it is, we want to tell the story from the people actually implementing. Yeah. So you'll be able to see some of investment in both digital application and even in just service delivery research across the different spectrum of providers that are in the health sector. But for after 1 p.m., we are expecting our chief guest actually is the CS Ministry of Information, Communication and Digital Economy. That is Eliot Awalo, accompanied by our CS. But we also know that L is devolved, so we have also the governor for Elgeyo Marakwet.
Okay.
Yes, Wesley Rotich, and so those are the 8 liners for our session. We selected them rightly because we are talking about information, digital health, and also he is the chair of the ICT caucus of the governors.
Yeah.
Yeah, of course we'll take them through the booths. Then after that, then we do have remarks that they will make, and they will also have the opportunity to listen. And we are focused on one of the sessions is really telling the journey for digitization for this country. And so that story, where we started from and where we have moved. We also will be seeing how the benefits of digitization, from the people who have implemented. And that will be from Shipwe and Kitangela.
Yeah.
We also, as you rightly mentioned, is resource intense. So we also bring in development partners. What is their take? How can they work that journey? How can they partner with the government? So we are having someone speaking on that. And then our minister or our cabinet secretary will crown it on by providing the vision.
Okay.
Yeah. Because from here, we expect that we have one common vision, one common roadmap that all of us can join along the way.
That's right.
And you complement the government, and we synergize so that we make it a reality. Then once we finish with those pictures, we take the chief guest through the exhibition booths.
Yeah.
And then from there, we move into a panel discussion. High-level panel discussion, very distinguished experts in this sector, and is not from government alone. They are from different, so there will be someone from Kakamega, a facility, the Metsu. We have got academia, one or two professors they have been in this space for long. I think we want to hear from them also from the academia, and now is able to how they meet with the service delivery. Yeah, definitely we also will want to hear from the counties, and then there will be a roundtable discussion.
Right.
And that roundtable discussion also bring together the people who have been in the industry also, so that we hear and learn from them. And so that is how the day looks like. But then we are running through the 3 pillars. So yesterday we started with the foundation. This is the primary health care. Today we are in digital health. We then going to address human resources for
resource.
health, and then we go to healthcare financing.
Right.
And health commodities, we actually will be addressing one, and we also did it over the weekend.
Yeah.
You remember the president also was able to attend an expo on local manufacturing.
Okay.
So that is it. We encourage people to listen in and also join us in Kapkatet.
Right.
Thank you.
And we ensure, we as TV47, that you get updates of all this for the better part of the day and to the night, where we'll also be having a town hall session that you do not want to miss out on. At this point, then we'll also allow you to interact, engage, as well as tell us your view as to where we are headed in relation to attaining the universal health coverage right here in the country. Remember, the theme, focuses much on making sure that we have health at the level of the household. Once again, Dr. Bernard Langat, the Acting Head Directorate of Digital Health and Research, Ministry of Health, Kenya. Thank you so much for speaking to us. We shift gears to a different conversation, but still in line with this, and we have our very own Moige William on standby, a different beat of the stadium, to tell us more as to what to expect, what is there, paint a picture of the universal health coverage in the country. My name is Linda Alela. To stay tuned for more.
Thank you, Linda Alela, on the other side of the ground, on the tent. Imagine, in as much as we are talking about health and the whole issue as we gear up to the main event that is on Friday, look, just behind me, stands. And all these stands are exhibitors of, in relation to health matters, digital, different stakeholders, talk of digital platforms, talk of health facilities, even hospitals. I've seen the Kenyatta Hospital, they also have a stand here just to exhibit on some of the services they're offering. Now, today we are going large on matters digital, digitizing the healthcare system. And I've come along somewhere here, along one of these particular stands that are here, one of the exhibitors, and he's so much, or rather this institution, rather this stakeholder is so much into the digital space. Why not engage him and get to hear more from him? Thank you for making time for us here on TV47. Today, as we gear up towards the main event of the universal health coverage that is on this year's Mashujaa Day, today we are talking on matters digital. And I am aware you're more into the digital space. But briefly, in a nutshell, what are you involved in as an institution? Starting off with your name.
My name is Harrison Mwiru, the Managing Director of Smart Applications International. We are glad to be here as participants in this year's UHC Mashujaa Day, as we recognize the pivotal role that digital health providers are playing in enabling the universal health coverage agenda. Today, as Smart Applications, we are proud to be one of the pioneer innovators around systems and applications in the healthcare insurance industry. We provided and innovated the biometric use of smart card technology from way back in 2003. And today we are proud to be serving over 4,300 different hospitals across Kenya in all the counties. We are proud today as we open this new chapter on our universal healthcare coverage journey to see that this government is recognizing what digital health providers play a very key role in ensuring patient access.
All right. Yeah. Let me pick your mind on this. You've talked about patient access, more so after nyumbani. Then let us quickly go through the application and how best does it suit for Mwananchi to get health access, or rather health services, at the comfort of the phone, or rather the application that you're talking about.
Smart has recently rolled out the Smart Access platform. It's an end-to-end patient engagement platform that enables members under different covers to actually access healthcare. They're able to locate their healthcare facilities of choice from the comfort of their mobile phones. They are able to see their cover information. They are able to see how their dependents are covered within the same policies. And they're also able to keep track of their healthcare expenditure. More so, they are able to learn preventative ways that they can ensure that they stay healthy and keep healthy. We have a variety of articles subscribed through the World Health Organization and any such actors who provide preventative information on our application. In this way, we have made it convenient for each and every member who subscribes to our platform to be able to access cover. That is what our application does in a nutshell.
Maybe do you have? Can we sample? Let us sample the application, because look, we are here in Kericho County, right?
Yes.
I am new to this place, right?
Yes.
And quite an ambience. We have quite an ambience. Weather, it's cool, all right. But let's say, for example, things go sideways for me. How best will your application come in handy to aid me as a patient? Let's see.
Yes. So if you fall sick right now, and God forbid that you do,
Sure.
you'll be able, through the comfort of this application, Smart Access application, to be able to see.
Let us aid this guy to see what we are doing. Just stand. We aid. Okay. So we are. What about the app?
You're able to see what you're covered for. Yes. You're able to see that these are your details.
Yes.
These are your covered benefits.
Yes.
How much you're covered for. You are able to see how much you've spent and keep track of your utilization.
Yes.
There's been no expenditure. This patient has been healthy, and you're also able to request for more options.
Yes.
So if you are to start a hospital visit,
Yes.
you can, for example, search for a hospital and initiate a visit, where you get a secure visit code that enables you to present this code for you to be biometrically identified at point of service.
All right.
Yes.
Quite.
You are also able to get a list of service providers
Okay.
wherever you are across
I
the
can
country.
see hospitals near me.
Yes, you can see hospitals near me, and you can be able to search, and it can show you different hospitals across.
All right. All right.
Yes.
Thank you. And I see the application up there is written, "Hey William." Is it me? Thank you for your time. Thank you for your time. Let us engage more exhibitors here. All right. That is one of the exhibitors here. Let us talk to more, because it's a whole dome tent full of exhibitors, and why not engage more? Because you can see quite a number of them. I can see Paldam, Health Strat. Why don't we hop in here at Health Strat? We get to see what are they dealing with. We get to hear more from them. Good morning. Good morning. This is TV47. We are live. We're talking to a number of exhibitors here, matters especially digital, and we saw your stand. Why not jump in and get to know what you guys are dealing in, or rather what you are specializing in matters of health, service, and matters digital. Who should I start with? Let me start with you.
Okay.
Let me start with your name. Just your name and bring us up to speed what you deal with.
Thank you so much. My name is Naftali Ongeri. I work with HealthStrat. HealthStrat is an organization that focuses on digital solutions for health systems. So at this point, we have a mobile application for data quality assessments. That is a tool that is in use to ensure that, as the implementation for health programs goes on, there is also a check on the quality of data that is being generated. So it's a system that we have worked with NASCOP to put it in place, and it is in use. So my colleague will talk about that. He's from NASCOP. Then there's the other aspect of support to the DREAMS program. So DREAMS is a program targeting adolescent girls and young women on matters HIV prevention. So we get girls to the program, ensure that, based on the vulnerability, they go through a series of interventions or services which are age specific, yeah? And then once they get the services specific to the age, then we're able to, to exit them through graduation once they have gone through all the interventions. So at the end of the day, the target is to make sure that they are DREAMS girls. DREAMS is an acronym for determined, resilient, empowered, AIDS-free, mentored, and safe. So by the time they are exiting the program, they should be DREAMS girls. So the health solution that we have in place is also a mobile application that ensures that then there's reporting from the point of service delivery, through a digital, a mobile application. The data is submitted real time and seamlessly to the database. And that brings in the efficiencies that we are talking about.
Sorry for cutting your trail of thought, but I'd love to hear this. I'd like to hear this from you, because the theme this time round, it's all about afya nyumbani. and also getting to the common mwananchi to access affordable health care. What is the ripple effect of whatever you're doing to mwananchi, and more specifically to afya nyumbani?
So this, as I said, brings in efficiencies in how the health promoters get to work. Yeah, because without the efficiency, then it means they have to carry registers and tools, to provide the services, and at the same time ensuring documentation on the paper. Yeah. So this mobile application then makes their work easy. They're able to reach more. They're able to provide quality services, without worrying so much about, a bulk of forms and tools that they have to carry as they provide the service. That is the efficiency that is brought in. And as you can see, this is actually funded through CDC to ensure then that, the efficiency gets in, and the systems that are in place are working efficiently to reach adolescent girls, and even, as my colleagues will explain on the DQA, to ensure that even the healthcare provider, as they provide the service, they are also having a good working environment, because it's digital, basically. Yeah.
Allow me to bring in one of your colleagues so that as we wrap things up here, you guys are demystifying the whole thing about healthcare system, bringing in digital aspect, easing things and opening up things when it comes to giving healthcare to mwananchi. I mean, how is it easy to demystify health? It is this one ambiguous factor, but you're making it simple.
Yeah, so...
Let us start. Let me get your name first.
Sorry, my name is Victor Kimathi. I'm an ICT officer. I work at NASCOP. NASCOP is a national organization that is mandated to take care of our HIV patients. And so to get back to your question is, we are trying to move, or rather the health space is trying to move from a place of doing things manually, using the registers and all that. So right now, with a click of a button, you're able to even access your entire data. So, and also this means that wherever you go, even if you visit one facility today and tomorrow you visit another facility, the facility where you're going to, they're able to get your data. So there's no too much paperwork, and all your records are centralized now, and anybody, so there's a history of your health and all that at a click of a button. So that is why we are moving towards the digital space.
Thank you.
Yeah, and so just to speak about the EDQA, this is an electronic data quality assessment tool that allows facilities and anybody working within the health sector to carry out DQAs. So DQAs are carried out either quarterly, semi-annually, or annually, depending on how an organization wants to carry out. And what this DQA does is just to ensure that the data, your data that is within the facility, or rather the data that is being collected, is quality. Because you know that quality data drives decision making, so that now the country is able to make the right decisions to target the right people. Yeah.
All right.
Yeah.
Thank you for your time. Look, you have heard from these exhibitors. It's all about making it simple through digital. It is paperless. Now with the help of digital, you can now be able to do things without use of any print, a lot of paperwork. And also, more importantly, you have a centralized place where you can access all this information. These are some of the innovation that we are getting here. A lot is happening. Look, all these, and it all boils down to one thing: digital and providing health services in a very easy way. All right, and here is Kemri. Kemri, good morning. How are you?
Fine, thank you.
I'll hold this for you. My name is William. We are live on TV 47, and today we are going big on digital. Well, Kemri, how is it for you in the digital world and providing affordable healthcare to mwananchi, to Wanjiko rather? So, starting off with your name.
So my name is Aaron Ngeno, and Kemri program is really having digital program in terms of research. We are collaborating with so many other programs to ensure that healthcare is enhanced. We have different programs at Walter Reed, Kericho. We are doing research and also laboratory services.
Let me put you on the spotlight a little bit. Look, we have all these gadgets, right? These are for testing specimens, picking samples. Then how do you simplify this by the use of digital to make it affordable for mwananchi, to make the healthcare system in Kenya better? Because it's all about afya nyumbani.
So what we do is that once we have the final product, the results, we post them in the internet, which we collaborate with NASCOP database to ensure that the results reaches to the facility level. Yeah. So I would want to Dr. Lucy to add in.
Oh, Daktari, yes. How are you? You know, it sounds good to call someone Daktari. Dr. Lucy, yes. Good morning. We have already spoken to your colleague. We were talking. We are engaging on matters digital, right? Simplifying healthcare system, or rather demystifying the healthcare system. Now that we are talking about afya nyumbani, how does KEMRI come in handy by the use of technology, making healthcare affordable for Wanjiko, for mwananchi?
Okay, KEMRI, we mainly engage in research. Yeah, and as we know, we need evidence-based medicine. And therefore, as KEMRI, we engage in research in diseases that affect the local mwananchi. And therefore, like for example, the tropical diseases that affect us here. So as KEMRI, we are going to contribute to the evidence-based interventions for these common diseases, which is going to translate to the common mwananchi. Yes.
That is great. Thank you for agreeing to talk to me. Again, thank you, Daktari. Thank you. All right. There you have it. Okay, now I want to take it over back to Lemuki, but as you have heard, there is a lot happening here. We are all talking about, or rather demystifying matters health by use of digital. Okay, I'm being told we move. All right. So using digital, and as you can see, all these exhibitors here, they are all into the digital space. But I'll take it to you back, Lemuki, as I continue speaking to Daktari. I mean, isn't it interesting to pick the mind of a Daktari? Over to you, Lemuki.
Well, thank you, Mwege William, for that. And it's interesting to see all those number of local manufacturers showing what they are offering there in Kericho County. You would never imagine that actually we have locally produced pharmaceutical products.
Exactly, and the direction they're taking, especially with employing technology, is very interesting. I saw one of those exhibitors there talking to Moige and showing how some of that technology just makes it easier for the patient to access medical care from wherever you are in Kenya. And I think these are some of the conversations we should be having. I'm happy that they're having those conversations in Kericho County.
It actually aligns with what Dr. Langat was speaking to, Linda was talking about, matters data protection, even in the whole healthcare system, how even the government, the whole Ministry of Health is really trying to streamline matters the data protection and ensure that as much as you have your data stored in, for example, that the whole smart access, but then, it is at the end of the day safe.
Yes.
And this largely speaks on the whole performance of the health sector in different parts of the country. And it was even our question of the day, but then in a whole kind of a poll asking you, are you satisfied with the performance of the health sector in your county, in your specific county? So there are 3 choices there. Yes, I'm satisfied. No, I'm not satisfied, and I'm not sure. About, so far, about 50 votes. There's 20 hours left in this particular conversation, so this conversation goes on. It's interesting that, I'll start with I'm not sure. There's about 18% of those who have who have cast their vote saying, I'm not sure. So really taking a look at the count and saying, I may not really say yes or no, really taking a look at how the health has been performed, even by the county executives. So that's about 18%. 76% say, no, I'm not satisfied. And 6% say, yes, I'm satisfied.
Okay. Quite some nice feedback there, because yes, it's also a week where the government also is taking stock of its achievements so far, and probably changing tack in as far as its approach to healthcare. And yes, even with the launch of UHC, I think issues will get better.
Oh yes, and it's good to note that the National Assembly will be discussing the primary health care bill. The Senate, will be discussing the primary health care bill. Remember, it is one of the 4 bills that were passed in Kakamega County were proposed rather by the cabinet. That is the primary health care bill. We have the digital health bill 2023, the facility improvement financing bill, and also the social health insurance bill. That is one of the bills to be being discussed in the Senate this morning. And of course, this is in line with the change of breaking down the former NHIF now to the healthcare fund, social health and insurance fund, emergency and chronic and critical illness fund. And definitely we'll see a lot of things going on, even as we look forward to the launch of the Universal Health Coverage 2030 plan on Friday by the President.
Oh, yes.
Yeah.
And that conversation will continue the entire this week. UHC Mashujaa Conference going on at the Kapkatet Stadium in Kericho County. After we wrap up, we'll be heading back to Kericho, where our team is there. We have quite a huge team there to bring you all the updates from that end. So from here, my name is Fred Ndumuli. I'd like to wish you a good morning.
And I'm Flora Limuki. Do have a lovely day.
I'm yours truly, Stanley Nyerinkita. Have yourself a terrific Tuesday on behalf of the production team that made this possible. Back to Kericho now.